Recorded. So welcome everybody to this URPE session on labor policy, visions for the Green New Deal. My name is Fadel Kaboub. I teach economics at Denison University. And it's my pleasure to chair this session with some of my colleagues from UMKC, at least some form of UMKC affiliation. So this session is primarily about some of the details related to the Green New Deal, why it's there, how to pay for it, what are the issues that we're trying to address, the structural issues that we're trying to address. And to begin in way of introduction, one of the things that the Green New Deal is designed to address are two things. One is to rapidly decarbonize the economy over the next decade, and two is to address structural inequality. And when we talk about structural inequality, it's a multifaceted, multidimensional concept that has to do with stratification in the economy, racial inequality, gender inequality, access to services, socioeconomic exclusion, including public health, education, and so on. So the way this session is structured, the first two papers that we'll look at will address some aspects of that multifaceted structural inequality concept. And then the final paper by Yeva will address the question of how do we mobilize real resources to afford the Green New Deal. So without any further ado, it's my pleasure to introduce the first paper, co-authors. The first paper is called Transitioning into Employment, Sectoral and Relative Wage Changes Since the Great Recession. And the presentation is going to be by Kyle Moore. And you'll see here on the Zoom call that we have two Kyle Moore. The first Kyle Moore will introduce himself. And then the second Kyle Moore is actually Taylor. So without any further ado, Kyle, the real Kyle, if you want to start the slides and introduce your paper. Thank you.
Yeah,
and as you do this, I'm going to remind the attendees to please use the Q&A section to ask your questions. This is going to be the way we're going to lead the discussion here. Feel free to use the chat box for casual comments, but questions that will be discussed by the panelists, if you could please put them in the Q&A section as opposed to the chat. Thank you.
Yeah, thank you. So I am Kyle Moore, and this is a co-authored paper with Tyler Fever. So this paper, what we're doing, we're looking at the employment issues that Fadel discussed in a bit more detail. We're calculating transitions of non-employed workers and looking at what sectors they enter when they go into employment, and a few other characteristics there focused over the last business cycle. So sort of what we had over the longest expansion on record. So both me and Tyler, we're looking at broader macro dynamics in our other research, but we felt that this was kind of an important piece to fit into those projects. And looking at this subsection of just those people transitioning into employment, I think so shows some interesting trends that the aggregates sometimes mask. So some of the motivation behind this paper. So like I said, we just had the longest expansion in a long time, came to an abrupt end, obviously this spring with COVID. Over that period, very low U3 unemployment rates, especially 2018, 2019, but very slow wage growth. The labor force participation rate remained very low despite the unemployment rate coming down, and we only really saw a steady increase in the final year or two of the expansion. So what we wanted to look into, of those who are transitioning into employment from non-employment, so from either a state of unemployment or being classified as not in the labor force, which sectors were they going into, which classifications were they coming from, and what were the types of wages that they received when they transitioned into employment. Okay, so just to kind of preview what we found. So we look at, we focus on 5 main super sectors here. So that's at the 2-digit NAICS code. And we find similar cycles in each sector. So during the recessions, the new employment comes increasingly from those who were classified as unemployed. They tend to enter part-time work. In the expansions, the new employment increasingly comes from those not in the labor force, and they're more likely to enter into full-time work. And so even though we see this pattern in every sector that we look at, there's still important differences across the sectors in terms of sort of the actual rate at which they're bringing workers in from unemployment or from not in the labor force, as well as the rate at which these workers transition into full or part-time. So hopefully this will become a little clearer as we talk about the data. And then the sectors with the highest employment growth we've found have lower wages, hired more individuals coming from not in the labor force, and were more likely to bring in workers to part-time schedules.
So we use current population survey data, and like Kyle was mentioning, we are concerned with, another way to say it is the jobs that actually existed. And we then narrow our focus on those who were previously unemployed or not in the labor force in the previous month. And we estimate that monthly gross flow from month T-1 between those 2 categories of either not in the labor force or unemployed. And we look as they transition into employment. We, again, like he was saying, we examine the sector. We're considering the employment status, whether it's full-time or part-time. And what we try to examine are relative wages. And we do this by creating 3 wage ranges. And we have to estimate an effective hourly wage based on various information that they give, that these respondents produce. And we consider a low wage to be if their effective wage is less than 1.5 times the state minimum wage. And there's a middle and upper as well. We're going to focus more on the low wage for this presentation, but we have several reasons why we use a state minimum wage, some of which are mentioned here. The federal minimum wage increased in 2009, but it hasn't since. And during that time, the real value of the federal minimum wage has decreased by roughly 17%. During this time, those states have increased their minimum wage. So we're using that one as our effective lower bound. And we simply just note that wages near this lower bound provide more or less a clear reference point for what is considered the relatively lowest possible wage. More can be said about that if time permits later, but that's our basic setup for estimating relatively lower wages.
Yeah, and so like Tyler said, so the data we're using is from the current population survey. This is the survey used to calculate all the government or most of the government employment statistics. We have that micro data. We're looking at the period from 2004 to 2019. Mainly it's a convenience because there was different industry codes prior to that. The industry or the sectors we're going to focus on are manufacturing, construction, retail, food and accommodation, and healthcare. And together those account for just under 50% of total employment in the US. So this is sort of how we've gone about mapping this data and looking at these cycles. So on the bottom axis here, we have the share of non-employed workers that transition into employment coming from unemployment. Right, so if it's 100 here, everyone who entered the sector was previously classified as unemployed. If it's 0, everyone who enters was previously classified as not in the labor force. Okay. And then on the vertical axis, the share entering into full-time employment. So again, a 0 value here would mean everyone entered part-time, 100% everyone entered into full-time. So here's what these cycles look like. We'll start with the manufacturing sector. This is where that sector showed up in 2004, right? So about 45% of the newly employed people in that sector were previously classified as unemployed. About 75% entered into full-time work. So we move 2005, 6, right? Again, pulling more from not in the labor force, more likely to go into full-time work. As we move into the recession, though, we see this shift to the bottom right. So the sector is more likely to pull in unemployed workers, but bringing those workers increasingly into part-time work. And then we sort of move the opposite direction over the recovery. Right? So as the recovery is taking place, more likely to bring workers into full-time work, but we're not hiring from unemployment as much. We're bringing workers directly in from not in the labor force. So this is kind of the cycle that we see. You can compare the start and end point there. Again, those movements, right? But we see it in most other sectors as well. So here's construction, there's the recession, again, pulling more from unemployment, more into part-time work. And then we move back to the upper left over the recovery. And won't do every point for these. So here's healthcare and social assistance. The purple dot is 2004, where we start. Again, you see the same movement. The black dot, 2019. Same in retail, and same in accommodation and food service, though 2019 is a little anomalous there. Okay, so this is illustrating what we said at the outset, the same cycle in terms of where workers are coming from, whether from unemployed or not in the labor force or full-time, part-time, in every sector we look at. But where each sector sort of lines up on this graph differs and doesn't change a whole lot relative to the other sectors over the cycle. We could sort of graph that like this. These would be the cycles within the sectors. And then there's sort of a broad line we can think of where we could plot each individual sector, showing sort of a general relationship between the likelihood of hiring from the unemployed, and that's associated with bringing workers into full-time employment.
Yeah, so the next thing we focused on, we keep more or less the y-axis is going to be exactly the same, but now we're focusing our attention to the share of total employment that are entering into relatively lower wages. And these dots that are up now represent 2004, and we can see there's a similar cycle across all of them. As we move into the recession, relatively more entrants are going to jobs that are relatively lower wages. We see in every single sector at least shifts to the right. And we can notice that the vertical distance for manufacturing construction is greater than those other three on the lower right. But then as we come back to 2019, we see the opposite shift. We see them coming back towards the left, which is the new entrants are increasingly relatively higher wages. But we obviously skipped a bunch of years in here, but this is the general pattern. And we noticed that, again, the manufacturing construction has more of a vertical change, as does like retail and food and healthcare. But the change at which retail and accommodation and food, their share of low wage employment changes is much greater than manufacturing construction. We can get into that in a little bit more detail later, but the general idea here is that these sectors all exhibit the same cyclical pattern across this recent cycle. But when we look at their differences across, we get that same general relationship that Kyle was showing in those previous graphs. So the next slide will show.
So can
Oh, sorry, go
also
ahead.
add, so if you compare the starting point in 2004 to 2019, the endpoint in each of these, you see none of the sectors shifted back to the left
Yeah.
in terms of the share of total employment in the low wage range. Each of them was
Right.
higher in 2019 than in 2004.
For sure. And that the share of low wage increasing started before the recession. I think that second point we labeled was 2010, but the share started to increase prior to 2009. And that's actually when the federal minimum wage did increase, but we can talk about that more later. But in any case, we see this general relationship, the cycle, and that difference across each of those sectors. But we are interested in, well, which of these sectors were growing? You know, what's kind of like one reason why we should even worry about what this is trying to tell us? Well, so this is what we do to try to answer that question. The x-axis here is simply if you're on the right side of the x-axis, you are a sector that pays relatively lower wages compared to the average. So we take the average of each sector, and if you're on the right of that, you have relatively more low wages compared to the average. The vertical axis looks at the same kind of question, but in terms of your relative employment growth. So if you are above the 1 on the y-axis, that is saying that your relative growth compared to the total average, you grew more. So the red and blue line, this is what we do to distinguish between the previous employment or previous status. The blue represents those classified as unemployed, and the red represents those classified as not in the labor force. So what we see here is that the upper right quadrant, those are the sectors that pay relatively lower wages, and those are the sectors that grew faster relative to other sectors. Now we see that both not in the labor force and unemployment exhibit very similar trends here. But then if we go and look on the left side, it's not as clear when we look at the unemployment. So if you pay relatively lower wages and you are hiring predominantly from unemployment, it's not necessarily the case that you were actually growing. So among the pool of people that don't have a job, if you hire from the pool of people that say they want a job, it's not necessarily the case that you're actually growing. The outlier there is construction, which we could talk about more if we need, but one of the points to emphasize is that the bottom right quadrant, if you go into a sector that pays relatively lower wages, the chances are that you're always going to increase employment, and at least in our sample, there are virtually no observations in that lower right quadrant. So if you there's a very small chance that you actually declined in your relative employment. So we find this to be kind of interesting in the sense that it might be missing some of the wage dynamics we're seeing, since both of these two classifications exhibit very similar properties over the last cycle. But we can talk more about that in Q&A if need be, but this is a general relationship that we have found. So these employment in the bottom or in the top right, lower wages again, and they're more likely to be part-time. Well, I think we might talk about it more in the concluding remarks, but these are those jobs that were just lost in the COVID pandemic recession. It was the predominantly service sector, and that just happens to be the predominant growth that we had for the past 10 years. So we can talk about more what that might mean, but as far as concluding thoughts, return back to Kyle on that.
Yeah, so just to sort of wrap up, so again, we sort of found and documented these common cycles within the supersectors between sort of in expansions and recessions, where sectors are pulling from, whether the unemployed or those not in the labor force, whether they're going into full or part-time work. But there's still clear differences in the actual rate at which that happens across the sectors. So one of the areas for future research that we think this suggests is there's clearly a lot of what could be called hidden unemployment within that not in the labor force category. Right? That's accounting for most of the new or the majority of the new entrants into employment almost uniformly across our sample. And clearly all of those people wanted to work, right? Even though they were classified as not in the labor force, the fact that they were employed, is a strong indication of that. And this is where Jordan, who was going to present after this, was going to dig into a lot more, looking especially at the demographics of these workers. And then, as we said, so the employment growth that we saw over the expansion, mainly in sectors paying lower wages, bringing part-time employment in. We should emphasize this still was insufficient to provide work to all those that were wanting it, right? So again, illustrating that issue in terms of equity, in terms of the topics that Fadl mentioned at the top. So that's it from us. Thank you.
Thanks.
Thank you, guys. So the next paper is going to be presented by Natalie Kane from UMKC and Children's Mercy Research Institute in Kansas City. And it's titled Connecting Economic Policy with Disparities-Focused Quality Improvement to Promote Health Equity. It's unfortunate that Jordan wasn't able to join us today. He's ill today, so I was hoping that both Kyle and Natalie and some aspects of their presentation will convey some of the work that Jordan is doing, because I personally see the all three of them kind of working in the same broad space. So without any further ado, Natalie, the floor is yours.
Thank you, Fadl. My name is Natalie Kane. I got my PhD in economics from UMKC, but I've taken a very interdisciplinary path. So I also study GIS and the geosciences. And my research focuses on health disparities, specifically the disparity in pediatric asthma most recently. And I'm going to be talking about that. It's going to be kind of a long walk and hopefully it lands. But what I'm going to be presenting has to do with how we break down healthcare data, that it's a good resource for us to be able to use it to target economic policies through the healthcare system, to be able to meet the needs of our most vulnerable citizens. And that kind of relates to both what Kyle and Tyler, and then also what Jordan would have talked about in terms of stratification economics. So being able to look at these intergroup differences to learn more about what the problems actually look like in order to be able to identify or resolve them. While I focus on the disparity in pediatric asthma, obviously this is going to connect because I'm talking about health disparities with COVID-19. So just some basic definitions. Health disparities are these differences in health or those influences on health that are systematically tied to social disadvantage and that make that social disadvantage worse. So it's not just differences between two groups generally, it's looking at differences that are tied to social disadvantage. So that means that health disparities are systematically tied to and evidence of institutionalized economic, social, and racial inequality, that it is driven by structural inequalities like racism. And I want to make clear, just because this is an interdisciplinary topic, but an econ audience, I assume, that this also is kind of evidence of vulnerable populations that lack choice and are unwillingly exposed to greater health risk. These are vulnerable communities that are limited in terms of their political power and voice, which matters, especially if we want to talk about using something like the Green New Deal to achieve both environmental and health equity. And that these are vulnerable communities that are disproportionately impacted by the costs as well of health disparities, both in terms of healthcare costs and quality of life. So the social determinants of health are an important concept. We're talking about the social and economic factors that have either direct or indirect effects on your health. These can be medical. Fadl mentioned access to care is one of them. That's kind of like the starting point for thinking about health disparities. People just aren't getting enough health care, but it's more complicated than that. It's also the conditions in your homes and neighborhood. It's economic factors like housing instability and unemployment. And some of these we can imagine, at least from more of a heterodox econ perspective, are modifiable. And in some health systems, they are becoming modifiable. Things like housing conditions can be touched through the healthcare system, but not all of them are. And that's a part of why I want to discuss this in the context of the Green New Deal. In terms of COVID, this is probably the most obvious health disparity and why health disparities are becoming more understandable or common. Racial, ethnic, elderly, uninsured, vulnerable populations not only are more susceptible to COVID, but are more likely to be exposed, in part because of the social determinants, in part because they're already subject to health disparities, giving them underlying conditions that make them more vulnerable to severe reactions. And in terms of social determinants, millions face eviction and foreclosure, tied to what Kyle and Tyler were just talking about, that massive unemployment. But that means they're losing the one protective factor that we're all told to use, which is a home where you can shelter in place. That makes housing a health issue, it makes employment a health issue. And that's recognized in the healthcare system more and more. So to be able to identify these disparities and then come up with solutions, you need to be able to use what information is available. And increasingly, electronic health records represent a valuable resource for that. Not just identifying disparities, but being able to measure the costs of those disparities and in different terms, not just healthcare costs, but also in quality of life, in health outcomes, and being able to track the efficacy of any interventions that you develop. An important piece of this is that health disparities are often tied to spatial factors and vary spatially. So place matters, and you need to be able to use spatial information to identify vulnerable populations, let alone design interventions. The big problem is if you don't have identifiable information, at least to some degree, you might miss patterns that would reveal a racial and spatial health disparity, which I'll talk about in a moment, but of course also the contributing risk factors. A good example of this is the Flint, Michigan lead poisoning crisis. Originally, the state of Michigan mapped lead poisoning rates at the zip code level, which is in the blue here. You'll see that overlaps with the city boundaries. So when you aggregate it to that geography, you miss that all of those cases were coming from within the boundaries of the city itself. Once they mapped those cases at the parcel level, they were able to reveal that it was actually tied to the city's water supply. That was the source of this lead poisoning crisis. In my own research, I look at pediatric asthma, and that's what I'm going to focus on for the rest of the presentation. And these are maps showing the rate and the distribution of pediatric asthma acute care visits in the Kansas City region. Kansas City is kind of the home of racial residential segregation, and it's reflected in the EHR. I was using electronic health records to create this. The map on the left here shows the density per square mile of those acute care visits, which are emergency department visits and hospitalizations. This blue line here is Troost Avenue, so the historic line of racial residential segregation in Kansas City. You'll notice a density east of Troost Avenue, which are largely Black, Latinx, and other racial ethnic minority and low-income neighborhoods. Same in heavily industrialized areas and segregated areas of Wyandotte County, and along the I-35 corridor here, you start to see patterns of hotspots, despite the fact that Johnson County here is largely white and wealthy. So what this means is we need to be able to identify where these disparities are occurring, because it's going to be a very different context. Whatever solutions we need to resolve them, which are going to be a combination of social, economic, and environmental, are going to depend on place and be specific to different communities. This map on the right shows the incidence rate. So I've normalized that count of acute care visits by the total population, which reveals that this is not just a consequence of population density. So if I take that sample of patients and I look at just the high-risk kids, these are kids who have 2 or more acute care visits in a year period, again, all derived from the EHR, we can reveal a more extreme disparity. We understand better that this is both racial and spatial. So if we look at these high-risk patients, 52% are Black non-Latinx. For a point of reference, in that study area, only 17% of the total child population is Black non-Latinx. And that disparity increases with both the count of addresses and, if we were to look at the encounters, that frequency of acute care visits. So over 71% of these kids have moved 2 or more times in a year period. 71% are Black non-Latinx. And it's the same kind of pattern with Medicaid coverage, which is an indicator of socioeconomic status. So again, these are 2 different indicators of social determinants that are tied to economic inequality and that we can derive from healthcare data. So health disparities like pediatric asthma require interventions, just kind of based on this information and based on the literature, that reduce exposure to modifiable risk factors, those housing conditions, environmental exposures, basic social services, to alleviate immediate suffering. And a lot of these really need to be context and community specific. They also need to, however, mitigate the impact of social disadvantage on health, which gets back to what Fadl referenced in terms of structural inequalities. So the design of our interventions, if we actually want to eliminate disparities, needs to take into consideration those structural inequalities. So we're talking about systemic discrimination in the labor market, for example. So the next step for me was to map out what does the process actually look like for applying this information and what role does healthcare play? And that led me down this path towards disparities focused quality improvement science. Quality improvement science in general comes out of management. Basically, it's systematic, data guided, and continuous actions that aim to measurably improve healthcare services and health services of targeted groups by improving uptake of best practices into clinical care. This is to say we're starting to measure the problem and be able to design interventions based on that information and then see how it changes over time and how do we adapt our methods as we learn more about how effective our interventions are. One of the big issues in the literature, though, is that if you apply these interventions universally, for example, an asthma management program is given to all children in the Children's Mercy Network, a lot of times it doesn't reduce the disparity and it can make it worse because part of the issue is institutionalized racism in healthcare. Being able to break down issues of health literacy where we're not connecting the patients who are patients who are most vulnerable. But then also because these problems are very context specific. So we may not actually be treating the issues that are driving high rates in different communities if we have a single intervention for everyone. So disparities focused quality improvement is aimed at taking into consideration that variation. So it's a combination of patient and population level analyses, and these QI interventions are adapted to the specific context and needs of vulnerable patients and communities. It draws on QI science then to measure that disparity and the impact of interventions so that we can guide changes over time. So there's a good example of this is the Community Asthma Initiative in Boston, which was a patient-centered and community-based program designed to reduce readmission rates for asthma. Again, asthma is, if you're not familiar, both a disease that's triggered by environmental factors and socioeconomic factors tied to genetics. It's a complex combination of all of those things that can affect patient health. But at the end of the day, it's a very manageable disease. So when you have really high readmission rates, that's a sign of a lot of different problems going on, and it is stuff you can fix. So they use their EHR, their electronic health records, to identify high-risk patients and then a control sample from a similar census tract. So incorporating external data sources as well. They provided nurse home care visits, case management services, so social services, home environmental remediation services, which they said they spent way more on than they budgeted for. So things like housing conditions, internal housing conditions that have triggers, think rental conditions. And all of it was tailored to the specific needs of patients. They collected cost and quality of life data. So along the way, they're taking into account how frequently they went back to the hospital, for example, and we can measure the cost of those visits, but we can also look into missed days of work and school and how those changed over time. And the results were that there was a sustained reduction in readmission rates and an improvement in prescription adherence and the quality of life measures, but a conservative cost estimate based solely on the reduction in readmission rates found that for every dollar spent on the intervention, $1.46 was saved. And the reason I bring this up is kind of twofold. A, we can affect disparities. But B, we can also measure the costs of things like social determinants in very meaningful terms, and these provide a good target for economic policy. So disparities-focused quality improvement has the potential to reduce health disparities, but there are some immediate problems. The first is resource constraints in underserved networks. So where there are large populations of vulnerable people, the health systems that service them tend to be under-resourced. That limits the ability to implement these programs. There aren't a lot of resources to do so, whether it is the actual QI, data collection, management analysis, or providing the resources for a program where you could provide environmental home interventions. Furthermore, and just as importantly, is that the social determinants of health are largely considered non-modifiable risk factors in healthcare because there are no resources to target them. So despite the fact that we know structural inequalities drive health disparities, and the social determinants of health are the key triggers for a lot of these problems, especially when it comes to unnecessary readmission rates for things like pediatric asthma, they're not viewed as something that we can immediately affect through healthcare. So healthcare is struggling to figure out how you can actually modify those root causes that are socioeconomic, that are structural, because that's what's getting in the way of effective treatment, especially as we go through this process, this long process of healthcare reform. And in my network in Children's Mercy, we often survey participants, stakeholders, and one of the things I find interesting and is a good example of what I mean about they're not seen as modifiable factors is that poverty, employment, and housing, despite being some of the most important risk factors, are seen as the most difficult to address, despite being the most, rated even among our stakeholders as the most important to health. So that's where something like the Green New Deal comes into play and the potential of federal fiscal policy, because we have the opportunity to take those non-modifiable factors, those social determinants, and turn them into modifiable factors at the point of care. So an example of this would be to take something like the community-based asthma intervention that was implemented in Boston and found successful in other places. Use electronic health records to identify vulnerable patients. You can do things like I did with mining the EHR to identify housing instability or related financial insecurity, indicators of vulnerability, high utilization kids. You can also use screening for social determinants, because with healthcare reform, increasingly health systems are directly collecting data on, are you subject to housing instability, food insecurity, unemployment? Can you pay your bills? So we're directly collecting this information, and it's made a part of the electronic health records. So it's a huge opportunity to be able to identify those vulnerable patients. And then if we had the resources of the Green New Deal, we could confidentially connect those at-risk families with federally funded, locally designed and implemented employment and housing opportunities to stabilize them, give them an opportunity to be able to make the best use of healthcare. So of course, though, there's problems. One of the big ones is that, like quality improvement interventions that are uniform in design, there's no guarantee that a Green New Deal program wouldn't exacerbate existing inequalities. And a good example of that is the problem of pediatric asthma in Kansas City, which is really closely tied to uneven development, racial residential segregation. So if we think about when those problems occurred and how that happened over time, a lot of it occurred during periods of stimulus, and that exploitation was a part of the stimulus itself. So we need to be just explicit, strategic in how we design our programs and make sure that there's accountability. And there's an option for doing that if we deliver at least part of these programs through the healthcare system. And there's a platform and incentive to do so. So that's my basic proposal, is to take this disparities-focused quality improvement methodology, framing it in terms of equity, so targeting people by need, and use that as a pragmatic and sustainable framework for delivering community-based Green New Deal programs. And just to reiterate, Green New Deal programs can sustain and expand those quality improvement interventions that we know can help alleviate and reduce health disparities over time. So drawing those social determinants into the realm of modifiable risk factors in healthcare through sustained employment, housing, and wellness programs. Things we can track participation through healthcare and see what those interventions do. If we think of the Green New Deal as an intervention, how they impact health outcomes, and be able to measure them in terms of at least healthcare costs, but more so, I believe. Then also we can build and maintain that disparities-focused QI in underserved networks. And that's, I think, low-hanging fruit to be able to sustain those kinds of programs through federal funding in underserved networks to achieve some of the triple aim of healthcare reform. So then on the flip side, disparities-focused quality improvement through the healthcare system gives some benefits to the Green New Deal as well, in that it provides a method and a platform for designing and managing community-based Green New Deal programs. So local, being able to identify and track those problems in context, things like the disparity in pediatric asthma, or even disparities in social determinants through social determinant screening data. Be able to design context-specific solutions, measure the impact of those interventions in meaningful terms. And by meaningful terms, I mean being able to say, what are the costs of unemployment in terms of health outcomes, as well as the social determinants or the quality of life indicators, which we could start to collect as well. We can also look at the impact of employment program efficacy in terms of those healthcare costs and outcomes, and in the reduction of social determinants for our patients. So additionally, and this is getting into the weeds and something we can talk about another time, there's this opportunity to connect the Green New Deal programs to adaptive information management, infrastructure, and practices, so informatics. To build a store of knowledge on program efficacy and context, because not every solution is going to work in every place. There will be hiccups along the way. There's going to be deficits in our data collection. Can we ask the questions we need to make sure that the Green New Deal is achieving its goals in terms of the broader impact that it promises, whether it's environmental, social, or health equity? So just to wrap this up, I'm arguing that the success of the Green New Deal when it comes to those broader issues, not just reducing the unemployment rate, for example, but also achieving environmental sustainability or reducing health disparities, improving the quality of life, really depends on equitable and context-specific program design and continual evaluation and improvement based on those equity targets and making it a priority to reduce those inequalities, which we can measure at least in part through the healthcare system. And the healthcare system provides a resource, but is also a beneficiary of the Green New Deal. Green New Deal, obviously, again, making those non-modifiable social determinants modifiable through the healthcare system through sustained funding for employment, housing, and wellness programs. But it also provides a resource for that equity-based, disparities-focused QI on a large scale so that we do continue to make progress in reducing unnecessary racial and spatial health disparities. And then finally, healthcare provides that means of designing and implementing Green New Deal programs in context to meet specific needs of communities and to track and evaluate Green New Deal programs in those meaningful terms when it comes to health equity. So that's the basics of it. If you have any questions, I realize it's a little off topic for this kind of conference, but definitely feel free to get in touch if we don't have time in the chat. Thank you.
Thank you, Natalie. This was great. I think it's totally on topic when it comes to the issues we're trying to address today. So our next paper, our next presenter is Yeva Nersisian from Franklin and Marshall College. And Yeva is going to present evaluating the real resource affordability of the Green New Deal. Without any further ado, Yeva, the floor is yours.
There. Okay. I'm on sabbatical, so I haven't been doing a lot of Zooms yesterday. I mean, these days, as you can see. So my take on the Green New Deal is more of a macro take, and my presentation is based on a paper that Randy Ray and I wrote, which is forthcoming in the Journal of Post-Keynesian Economics. We wanted to counter the narrative that was building around the Green New Deal as it became more popular, that it's going to be unaffordable because we can't pay for it and we are going to need tax hikes and so on. So our take on this issue is an MMT, Mother Money Theory take, and also we draw on Keynes. Keynes says how to pay for the war to inform our analysis. So before I move any further, I just want to emphasize what we mean by a Green New Deal, because different people mean different things, and in different countries, people mean different things when they say the Green New Deal. For example, in Europe, when people talk about the Green New Deal, it's largely just about greening the economy and fighting climate change. In the US, however, the comprehensive Green New Deal resolution that got the conversation started to begin with, the one introduced by Alexandria Ocasio-Cortez, was much broader, and it included greening the economy to fight climate change, but also healthcare for all, so something like a Medicare for all or a single payer system, a job guarantee, or at least some kind of guaranteed jobs program, student debt relief, public education, free or accessible, universal child care, access to food and shelter, and so on. So in our work, we focus on the three main parts of the Green New Deal, because these are supposed to be the most expensive parts of the Green New Deal. So we wanted to look at those and see whether they're actually expensive from a real resource perspective or not. So as I said, the initial reaction, and it's not just limited to critics of the Green New Deal, but also the proponents, is that it's too expensive. So, the critics would say we can't afford it, and those who supported it would say, well, we can, but we need to raise taxes, we need to tax the rich, we need to impose some other kinds of taxes like financial transaction taxes and so on and so forth. Our take is that we don't really know if we need to raise taxes from the get-go. Just because the government needs to spend more doesn't mean that it needs to raise taxes. So the most cited measure of the cost of the Green New Deal was this study done by the American Action Forum. It's a conservative outlet, and they estimated that it was going to cost us $93 trillion. As you can see, the cost of single payer or universal health care and the job guarantee, those were the bigger costs, right? So things that would actually help us transition to a greener economy weren't as expensive as the more economic components, so to speak, of the Green New Deal. So their method was basically to estimate the cost of the different programs, to add them together, and then to say, well, this is how much we need to raise taxes on the average American household. Of course, the number was crazy. You could never, raise it. And this is over a 10-year period, by the way. And then say, this is clearly a crazy program, it's unaffordable, and so on. So the MMT approach, of course, says that this financial kind of accounting is basically useless or not very useful for a country with a sovereign currency, because a country with a sovereign currency like the United States has the financial means to afford whatever is technologically possible. So assessing the economic feasibility of the Green New Deal needs to focus on the real resources. Do we have the labor? Do we have the materials that we need for greening the economy and providing universal health care, as well as public education, childcare, and whatever else we want to include in our Green New Deal? Do we have the resources for that? That's really the important question, because if we don't have the resources, then finance is not going to help very much. And the COVID pandemic was a good illustration of that, because at the beginning, and even today, there is a shortage of PPE, there was a shortage of ventilators and other real stuff that we needed. And despite how much money the government threw at that problem, it wasn't going to help. Instead, what happened was that the price of the things that we were trying to buy was going up, as states were beating against each other, trying to buy what was in limited supply. So the real issue with the Green New Deal is the same. Do we have the resources? And if we do, how do we mobilize them? How do we shift them from other uses potentially? So how do we shift them from, say, fossil fuels towards the greener energy projects that we want to engage in? How do we shift resources from, say, administration of healthcare or health insurance into, say, the delivery of actual healthcare, which is what we need? So
may I ask you to move your microphone? It's making a lot of scratchy noise background. Or just adjust your microphone. Yeah, thank you.
Okay, let me know if the problem continues. Thanks. So, from the MMT perspective, the US dollar is a sovereign currency, and that's defined as currency that's not backed by gold or pegged to another currency. The US government does not issue debt denominated in foreign currency. So we have a completely sovereign currency, at least since 1971. So for a country with sovereign currency, of course, financing its spending is, there is no such thing as financing spending per se, like there is for the private sector. So the government spends by issuing its IOUs, which amounts to crediting bank accounts in the modern monetary system with banks and the central bank. So I'm not going to go too much into that, because I don't know, the background, the MMT background of the attendees, but I'll be happy to take questions in the Q&A about that. I'll just say one thing, that this is not, of course, news in a sense that even economists understand that, and policymakers understand that the US can afford things financially. It's just that there is this connotation the negative connotation associated with, say, printing money, or even, the invocation of the concept of printing money, which itself is negative, right? Is what is always brought up when we say that the United States government is not financially constrained. But here is a quote from Alan Greenspan, and this is not the only one, of course. He's also said in relation to the social security system that financially, of course, it's not an issue. We can always afford to make good on our social security commitments, it's, money is not a problem basically there. So we acknowledge that the central bank is not financially constrained, but then we don't seem to take that logic further and say that it's the US government that is not financially constrained. So leaving the MMT aside, which basically says that financially we can afford it, I want to focus on the real resource aspect of things. And this is where Keynes's How to Pay for the War is useful, because at the time, when Britain was planning for World War II, Keynes was an active participant in the government, and he was trying to influence the policy and popular opinion toward a particular way of financing the war, which I will talk about in just a minute. But Keynes's approach is very much in line with the MMT approach, which says that finance is not a constraint, real resources are the constraint. And I'm not saying that Keynes was an MMTer, right? I'm not saying that Keynes was saying, oh, deficits don't matter and so on, or not that that's what MMT is saying either. So Keynes wasn't saying that the government is not financially constrained. He was just saying that if you're planning for something like a war, which requires major mobilization of resources, then you need to think about it as a real resource problem and not a money problem. So you need to determine how much output you can produce, and then you need to determine how much of that you need for the war effort, and the rest is what you can use for civilian consumption. Now, if the population tried to consume more than that, of course, that would then lead to inflation. So during the war, production and incomes will increase. So we go from this situation, which is typical for a capitalist economy, where we have a lot of available resources, such as labor, to a situation of relative scarcity where resources are scarce because a lot of it is being used for the war effort. So the question here is not money then, it's about how to constrain your civilian consumption or demand to avoid inflation, because people are working, the economy is at full employment, and they're earning this income, but they cannot spend that income to buy the stuff, because a lot of what the economy is producing is not available for consumption, because it's tanks and warheads and those kinds of things, right? So Keynes said basically that there are three ways to control consumption / demand to avoid inflation, and these are taxes, voluntary savings, and deferred compensation or forced savings. That was the term that was often used at the time. So taxes would be one way to control the use of resources. If you tax away a lot of the income that workers were earning, then there is no extra income to be spent on buying resources, so you solve the problem of inflation. But it's not a very good way to do it, because then labor is not able to enjoy the fruits of its own labor in a way, right? They're working harder, they're working more, and you want them to get a higher standard of living as a result of that. But if you tax a lot of that extra income away, then you're taking away the you're reducing their living standards potentially. So at the time, there was also this argument that we need to just tax the rich, right? Just like today, there is the argument that we need to tax the rich to pay for the Green New Deal. And Keynes basically saying that even if you were to tax the rich at something like 70% of their income, or if you were to take away 90% of their income, that is not going to be sufficient, right? Because the income still stays in the hands of the working class people who are going to spend it. And there is, if they were to spend all of it or a lot of it, it's still going to be inflationary. So taxing the rich does not withdraw sufficient amount of income and resources and claims on resources from the economy. That's basically the argument. And we basically say that the same applies to today's economy as well. We could tax the rich at high rates, including the 70% that was proposed by AOC, but that's not going to be sufficient to reduce the use of resources by the rich. We could also rely on voluntary savings, so try to promote people saving their income and spending it later. So that way we also sort of delay the use of purchasing power, and we postpone it into the future so that we don't face inflation today. But this, of course, requires collective action, right? Because if I save and nobody else does, and they keep spending it, then there's going to be inflation, and the value of my savings is going to go down in real terms. So that's not very useful. So this would be inflationary according to Keynes, because you would then, the firms would basically get windfall profits, which they would save, they would consume, or they would, they would pay in taxes. So he says that in this case, they would just act as tax collectors on behalf of the government. But the point is that workers would not be able to get more in real terms. So they would be spending their income, but they would not be getting more in real terms because of inflation, and because it's, there is not enough output available to increase their real consumption. So in this case, workers would demand higher wages, which would catch up with prices, and we would go into this, sort of wage price spiral. The last option, which is what Keynes favored, was some kind of deferred compensation or forced savings. So you would tax some of the income, and then you would put some of that into some kind of a savings account, and the government would be in charge of that. And after the war, you would pay people back in installments over time, so that you would avoid inflation during the wartime, but you would also avoid the post-war slump, because people at the time were very much worried that after the war ended and the government withdrew from the economy, we were going to see another Great Depression. Basically, we were going to fall back into the Depression. So according to Keynes, this would then keep injecting demand into the economy as these installments were released for people's consumption. All right. So just to summarize Keynes's approach, basically he's saying that we need to think of war planning as a real resource problem. We need to ensure that we don't try to buy more resources than what's available, because that's going to be inflationary, and that doesn't really help anyone, especially not the working class, and it doesn't lift their standard of living. Now, the same logic applies to the Green New Deal, because the Green New Deal, we can approach it as a planning for the war, basically, because we're going to need to use a lot of resources for the Green New Deal, or at least that would be expected as far as the greening component of the Green New Deal goes. But what we argue is that some of the Green New Deal programs would actually release resources. So they're not going to just demand more resources. Some of them will actually be a source of additional resources for the economy, as I will explain in just a minute. So I think Medicare for all or single payer, that becomes more explicit, but the same can be said about the job guarantee. So the job guarantee, is it a use of resources or is it a source of resources? When you think about it in just financial terms, you say, okay, we need to pay people, and they're going to, so that spending on this program is going to increase, or it's going to increase government spending. So financially, it's just viewed as a cost. But when you think about it from the real resource perspective, you see that it is a cost, and it's also a source of resources. So we estimate that and this is based on the Levy proposal for the Green New Deal, we estimate that for the job guarantee, that the cost would be about 2% of GDP, and this is 2017 or 2018 GDP that we use in our estimates. But at the same time, if we could use about half of the job guarantee workers for greening projects like insulating homes or other projects that don't necessarily require a lot of specialized skills, then we can, that we can save the 1% on that. So, it's the cost in terms of resources is 2%, but then you get 1% back because you're using half of those workers in terms for your greening projects. And so the net cost in this case would only be 1% of GDP and not 2%. So the Medicare for All, it's a clear example of how this would release resources for the Green New Deal. What I have on this graph is just the percentage of GDP that different countries, and these are OECD countries, spend on their healthcare. And you can see clearly that the US is an outlier here. We spend more on our healthcare, but we don't necessarily get more out of our healthcare system, at least not in real terms. And you can see that the next country with the highest spending on healthcare is Switzerland at 12%. So, you know, it's a very big disparity between us and other, and our peer nations. So, you know, developed countries in Europe, for example. So if we could lower our spending on healthcare, let's say bring it more in line with our peers, and we're going to go but with a conservative estimate of about 4%. So we're not even bringing it down to 10% or 12%, right? If we were to take it from the 17 to say 13, right, which is still higher than most other countries or all other countries, then we would still save resources. So if you think about the Medicare for All as a financial issue, you say, well, we need to spend more, right? The government is going to be spending more on healthcare. But if you think about it from the real resource perspective, we will be devoting less resources to healthcare, even as we care for more people, okay? So in this sense, if you, for example, get rid of the private health insurance industry, you are releasing these resources that the industry currently uses, and those resources can be used for other Green New Deal projects like greening the economy or and so on. So the way you would do it, of course, and I just want to spend just a little bit of time here. I'm not going to go over the numbers too much, but the reason why the US healthcare system is so expensive is due to two things. It's prices and administrative costs. So this is what you would need to, or this is what you would hopefully target with a Medicare for All or a single payer system. So administrative costs in the US run around 8% versus 1 to 3% for the other countries that I showed. And of course, pharmaceutical spending is extremely high, and so is the compensation of healthcare workers. So it's really prices, right? The price of labor and the price of drugs and the administrative costs. So if we could lower those and bring them down, again, we're not assuming you're going to bring it down to 3%, right? We are staying really conservative with our estimates. Then you could save a lot of resources here. And so savings range from about 1.6% to 4.5% of GDP, depending on your assumptions about how much you can reduce administrative costs and the price of drugs and so on. So our own estimate is that you could lower spending on healthcare by 3.7%. So this table summarizes the resource uses and resource needs of the Green New Deal. Of course, greening the economy is a positive number because we're going to devote more resources to this. The job guarantee, as I said, you know, it's a cost and a benefit, but on net, it's going to be a cost. While Medicare for All enters here with a negative number because it's going to be a source of resources. It's going to release resources for use in other programs. And we also, you know, budget 1% of GDP for ending the 4-hour wars, because this is also something that the advocates of the Green New Deal want. So if you look at the net resource cost, it's actually 1.3% of GDP annually for 10 years. And pre-COVID, you could say, okay, this could probably be inflationary, but right now, if you were to implement it right now with the labor market being where it is, then it's not necessarily clear that this itself would be inflationary. In our paper, we look at capacity utilization, and we show how it has gone down, you know, since the 1960s. And also, you know, what's the ability of the economy to absorb more spending, right? So 1.3% of GDP, that's not very much, right? If you just look at 5% per year for 10 years, you could say, okay, that's a lot, right? But 1.3% is not that much. So this actually shows that if you do the Green New Deal as a comprehensive package, rather than implement these projects separately, then you actually are are doing it the smarter way, right? Because if you just implemented Medicare for all, that would be deflationary. If you just implemented, greening projects, then that could be inflationary. But if you combine the two, then it's the better way to do it. So we basically go with a Keynesian kind of tax increase. We say if you do need to increase taxes because you do see inflation picking up, then you could impose a payroll tax surcharge, which we estimate would save about 2% of GDP. But this would be similar to the deferred compensation per Keynes, so that you would increase the payroll tax surcharge today, but you would offer better Social Security benefits down the line, so that you're not punishing workers who are being continuously punished for the last 40 years or so, with no wage growth and so on. All right, so our conclusion is that similar to the New Deal and how we came out of World War II, the Green New Deal can make lasting changes in terms of advancing us towards economic equality and higher standards of living for the larger portion of the population, and not just the millionaires and billionaires, to use Bernie Sanders' often used term. So our estimates are very, we're not attached to them, so to speak, because there's a lot of uncertainty, right? How much it's really going to cost to green the economy. What can we say about technologies for the next 10 years, right? Things could get much cheaper as far as green technologies go. So there is a lot of uncertainty there, or the same can be said about Medicare for all. So our main goal has been to try to switch the debate away from the financial cost accounting toward the real resource accounting, because those two require completely different solutions, right? If you think about it as a financial problem, then you say we need to raise taxes, and you don't really care what kind of taxes you raise. And if you are thinking about it as a real resource problem, then it completely changes how you approach planning for the Green New Deal and how you think about taxes, right? And what kind of taxes you think you need to increase. All right, I probably went over time, so I'm going to stop right here.
Thank you, Yeva. This was a great presentation, everyone. So with that, we have just about an hour, a little bit less than an hour for Q&A discussion. Please post your questions in the Q&A box. It will help me sort out who's asking the questions. I should be able to unmute participants to ask their questions verbally. If you want to do that, please raise your digital hand if you're familiar with that option. If not, just type your name in the Q&A and I'll try to unmute and let you ask your question verbally. This is an URPE session, so I'll try to honor the URPE rules. So women and underrepresented participants should have priority in asking their questions. And I'll also invite the participants to engage in conversation and questions with other panelists. So with that, I'm going to start with the first question that was posted in the chat box by Mark Looney. And it's actually two questions for Natalie. The first question is in regards to the EMR data. Natalie, are you suggesting economic interventions geographically or individually? And if individually, how do you interact with HIPAA? And then the second question, are the providers willing to use this data for such beneficial economic/wellness intervention? Natalie.
Yeah, so these are really great questions and ones that I'm a little bit obsessed with, so I appreciate them. For starters, with the HIPAA data, Part of the reason I like the idea of delivering Green New Deal programs, at least in part through the healthcare system, is we're able to reach the most vulnerable patients, but in a confidential way, taking advantage of the structure of HIPAA to begin with. But at the end of the day, making sure that that information that is tied to their electronic health records is secure depends on the informatics solutions. But those solutions are also a part of how we can make those solutions those programs, whether it's employment or housing, available to individuals based on their immediate needs or geography. So that's another thing that we could talk about more if there's time. One of the things I'm working on at Children's is a tool in the EHR that securely geocodes the patient address information and can pull in spatial data to present it to the provider at the point of care so that they have a better understanding of their social or environmental context. But one of the big issues is actionable information. So you're definitely hitting on some important points with the HIPAA question. So thinking about the informatics solution, you'd want to design it so that you can communicate, these are the programs that are available based on need, and then safely enroll them in those external programs without exposing their information. The good news is that there's a precedent for that with community resource connection tools. So there are different programs throughout the country that are being used where they can use spatial data, connect people with like community service organizations through the electronic health record. Part of the challenge being just tracking those referrals so we understand what programs were effective and what weren't, but there's a basis for it. And it's one that is compliant. So you can achieve that. Either way, we need to be able to structure this so that we can evaluate the program. So that's one of the big issues with those informatics solutions. We're going to protect that HIPAA data and then also achieve our goals with the program. But then also one more side note, part of the benefit of having this as data that's connected to the electronic health record is that there are barriers to being able to use it for research and planning. And I think appropriate ones, because you start to put it in the context of like ethics and clinical research, how we ask questions with this data matters. So like if I want to use patient health information right now, I need to submit IRB approval for it, create an IRB protocol. So an institutional review board, there's a review process for asking questions about that information. So it's a little secure at first, especially if we're thinking about, we're talking about the most vulnerable populations that we want to make sure are receiving the benefits of these programs. So the second question is also really important. There's growing interest, at least in my experience working with pediatricians, doctors involved in our Children's Mercy Health Network as well, so not just within Children's Mercy itself. So there's a great willingness to be able to do something to address social determinants, to learn more about how it's affecting patient health. That's a part of what I'm learning and working with this environment tool that I mentioned. So bringing patient context information to the point of care. The big barrier is, of course, they don't really have any tools to directly affect it, but they know it's a part of what's a challenge for their patients or that's getting in the way. The other big thing is that there are incentives slash, I don't know how I want to put it, incentives or pressure on health systems to be able to start monitoring social determinants and then responding to them in some way, using a demonstration of the meaningful use of electronic health records is a part of the recent healthcare reform. So it does kind of go back to that informatics solution though, because while there is that willingness, we do need to think about how we make these tools available to providers so it doesn't encourage things like implicit bias, and that they are trained adequately, and that the information and the tools to be able to connect people with resources work efficiently enough in the EHR that providers can make the best use of it at the point of care, that the patients are actually getting connected with what they need. So each of these things require a lot of resource investment, time, development, testing to be able to build those solutions so that it is secure, but it achieves those aims, that we can evaluate it, but it is meeting HIPAA requirements. But that's kind of the benefit of, again, of talking about this in the context of Green New Deal programs, because there is the potential for us to invest funding in this, which would result in cost savings for health systems and patient families. So I hope that answered your question, but if you have any others, please feel free to shoot.
Thank you, Natalie. I see a second question in the Q&A section here, and I think this one is for Yeva. This is from Michael. Can the Green New Deal make a dent in the need to stop global warming at 2 degrees Celsius without actually degrowthing, without degrowth?
So I can't really talk about the 2 degrees Celsius warming. My understanding is that we are already past that. I mean, if we were to implement a Green New Deal today with a sort of an aggressive timeline of 10 years, maybe there would be hope. And again, I'm not really sure if there would be. I think it's more of a question for scientists, and my understanding of the scientific consensus is that we're sort of late on that already. Now, the growth question, I think it needs to be, so I would say one thing, that growth should not by itself be the goal of the economy. And if we were to achieve some level of higher levels of equality through the Green New Deal, then with better distribution, we could improve the standard of living of people without necessarily needing to grow the economy, at least not at very fast rates. I'm not really a proponent of the growth itself. I mean, as long as, I guess, the population is increasing, we do need some level of growth to ensure that we have enough. But one thing to keep in mind is that a lot of the pollution comes from the fossil fuel industry, right? So if we were to completely eliminate the fossil fuel industry and use alternative sources of energy, then we could, my understanding is that we could still grow the economy without necessarily the negative impacts on climate. Okay, so that would be my answer. But I would say on the 2 degrees Celsius question, I'm really not an expert on the scientific side of the greening the economy. Our understanding is that the technology to do so is available. How quickly we can phase it in, that's another question.
Thank you, Eva. Yeah, I would just add a quick comment to this, and this is my take on it. I don't think a US-based Green New Deal is going to be sufficient to tackle this, because inequality is global, global warming is global, it's not just US-based. So there's a need for a global Green New Deal framework. And I just posted a link to a couple of things that I've done in case people are interested. I don't have any other questions in the chat here, but please, Yeva, go ahead.
Yeah, I was going to say, it's true that it's not just the U.S. problem, but the U.S. happens to be the biggest polluter, right? And we happen to also consume a lot more resources per capita than most countries in the world. So I would say if the U.S. and Europe were to take action, and China seems to be taking some kind of action, then that would be a good start. But not just because they would do it domestically, but because they could also impose certain conditions on imported goods, right? So if you want to sell something in the US, then it needs to comply to certain standards, for example, right? I don't know, zero carbon footprint or this and that, because, you know, the US and Europe are major buyers of goods produced globally. I think if they weren't just to focus on the domestic policy, but to say that if you want to sell to us, you need to comply by certain standards, I think that could go a long way. Absolutely.
I have a question, I guess, for all the panelists, and I think this kind of emerged as a subtext of all these presentations, which is the following. So if because we're in a recession now, and everybody's talking about a recovery and stimulus. And what came out from all these presentations, that stimulus in and of itself is like feeding the existing engine of the economy more spending and accelerating the production of pollution, the production of socioeconomic exclusion, the production of all of these disparities that everybody discussed today. And I guess what we're suggesting with the Green New Deal framework is a transformative framework. In other words, changing the engine of the system as opposed to feeding it and accelerating the production of similar outcomes. So I wanted to give everybody a chance to elaborate on this, maybe starting with Kyle and Taylor, in terms of, you know, we've seen the recovery since 2008, but it didn't produce the outcomes that a Green New Deal would produce, right? Same thing with the health issues, same thing with, you know, overall Green New Deal framework.
Yeah, I mean, I think that's exactly right. I think, you know, thinking in terms of transformation and policy and stuff, a lot of or what we presented and what we're finding there, I think, directly supports the job guarantee aspect of the Green New Deal program that Yeva discussed. And yeah, because it's, that engine, as you mentioned, is clearly insufficient to provide adequate employment for all of those that want to work. And again, it's a shame Jordan wasn't able to make it today. That program or that presentation would have gone into the weeds on that a bit more, and showing that even on the eve of COVID hitting, there were still millions that were wanting more work, and going into some of the especially racial disparities in those employment outcomes, which Natalie can speak more to, but clearly showed is related to all types of other inequalities and disparities.
Yeah, I definitely think that a part of what would make the Green New Deal more successful is to emphasize its transformative potential. And that's why I tend to emphasize context and community, because especially when you're talking about environmental solutions, reducing our emissions large scale, that means a lot of different things for a lot of different communities. And we also have to balance, human experience and ethics as well, because a lot of what I was talking about with the health disparities, that's evidence of a lack of political power and voice and how we decide to use society's resources. And that's fundamental to sustainability. So if we want sustainability, we need to be able to take into consideration human welfare. That really kind of depends on the way we transform local economies. We can use this funding to transform local economies. We have to keep in mind that they're moving targets, and that we have to prioritize those human rights as well, and make those solutions context specific. Because again, one big program, one big infrastructure program we know is no longer, sure, generally federally implemented, you can have a general infrastructure program, but you're going to have to think really critically about how you design and implement that, even down to the local level. But anyway, so that's just kind of taking it back down to the local level. That federal funding is essential, but that how we actually implement and design those programs locally will guide a lot of the sustainability potential of the Green New Deal. If that makes sense.
I think you raised a very good point, Fidel, with respect to the stimulus as opposed to other kinds of economic policy. I've been reading a lot about the original New Deal recently, and originally the New Deal was a lot about planning, right? That we weren't just going to increase spending for the sake of increasing spending. We were going to do things that the economy needed. Like if you think about the Tennessee Valley Authority and everything that it did, right? Or electrifying the, South or the West and so on. So we were trying to do particular things for the economy, and then increased spending was sort of a side effect of that, right? Or we were directly hiring workers because we wanted to provide employment, and then increased spending was sort of a side effect of that. But then we went from that kind of approach to policy making towards a more compensatory approach, where we just increase spending and then we let the chips fall where they may, right? And that's been a major problem. And so with the Green New Deal, I think when you're invoking the original New Deal, I would say that you're also bringing back this component of planning to some extent, right? Or hopefully that's the way that you would implement a Green New Deal. So you wouldn't just give subsidies and let the private sector decide how it's going to produce more solar panels and this and that, but you're going to be a little more, a lot more involved than that, right? Because there are other issues that need to be taken into consideration. It's the geographic, the geographic side of things, right? That there will be people who will lose their jobs in the coal industry or fossil fuels, and that's not, and that has a geographic component to it, right? That these industries are located in particular places. So you need to make sure that you're directing spending to those places, right? Or at least you find a way to transition these workers out of that kind of employment and toward green employment. There's also the question of race and gender, which the original New Deal didn't just ignore, but exacerbated to some extent, right? At least when it comes to race, because there were a lot of exclusions, right? That Black people were excluded from New Deal programs, for example, and that was a problem. So you need to put social justice in a way in the center of your planning, right? How do you do it in a way that you don't repeat the mistakes of the original Green New Deal, the original New Deal, and how do you achieve more equitable outcomes?
Thank you. And I see, well, first of all, I wanted to say hello to all of our attendees. I see a lot of familiar names and also a lot of new names. So it's great to see quite a few friends following us here and asking questions. A comment from Ron Bayman. Hi, Ron. He said, to answer the question regarding the trend towards 1.5 or the 2-degree global warming, there's an URPE session at 10 a.m. on Tuesday, so please check it out for more detail. And Ron's paper is uploaded on the ASSA website and addresses this question, so that's wonderful. I don't see any additional questions, so I'm going to abuse my my role here as the chair and ask more questions. So a question for Natalie. At some point in your presentation, one of the numbers you showed was spending $1 on, addressing the health issues produces a $1.46 in savings, right? Am I citing this number properly? So would it be reasonable to say, because a lot of the time when I think about the cost of doing nothing in terms of decarbonizing the economy or addressing the structural issues that we're talking about, would that be an acceptable way of estimating the cost of doing nothing, or am I missing something here?
No, I mean, that's a big point of healthcare reform is there's all of this massive cost in healthcare. And so the triple aim, something about, trying to reduce unnecessary readmissions and those types of unnecessary healthcare costs, improve patient experience, and improve population health. Those are kind of some of the big aims. All of that really at the end of the day, part of it is to, shift from this fee-for-service model to outcomes-oriented model. So focusing on those outcomes, but ultimately that's reducing costs. So as the system is now, it's incredibly expensive. So if we do things like actually mitigate health disparities, we reduce costs both for healthcare systems and patient families and society at large. Case of pediatric asthma being another good example, because we're talking about missed days of work in school. So we can start to see what the repercussions are of actually resolving these health disparities. And we can start to measure, again, unemployment and these programs in more meaningful terms. But one thing I wanted to note also that when I was kind of drafting this policy note, and why I was thinking about it being important to start connecting healthcare reform to things like the Green New Deal is because this disparities-focused quality improvement is often held up as a means of building up savings to address social determinants. So authors will write about how the political feasibility of Medicaid for all, knowing that that would reduce costs. So instead, we can take this framework for actually reducing health disparities, which we know can reduce healthcare costs, and that can generate savings to start addressing the social determinants. So if we start to insert into the conversation, well, really, we can facilitate that disparities-focused quality improvement and provide the resources to sustain that over time, then it is a benefit in general. It's going to pay for itself. That's another big benefit of thinking, all right, well, there's already an avenue for delivering some form of the Green New Deal. We can talk about it as just general federal fiscal policy through the healthcare system, because there are incentives for it, and it will result in cost savings across the board. That's what we're seeing is needed. So
absolutely, and that number, is that Kansas City specific, or is that a national estimate?
So that was based on a Boston study, and there are some other examples, but I am very excited to work with this community, this Children's Mercy Health Network. So it's a clinically integrated network. So it's not just Children's Mercy pediatricians, it's pediatric offices from throughout the Kansas City region. And so they're kind of, thanks to healthcare reform, they've joined together to be able to meet these incentives, which is part of why I said incentives/pressures on the healthcare system to be able to meet these goals. So things like reducing unnecessary ED visits for pediatric asthma, they've implemented an asthma management program. That means all the offices in the region are implementing the same program. And then they're also able to track patient outcomes across health systems. So we're seeing whether or not did this pediatric office actually meet its objectives, the incentive requirements for improving asthma management. And did that affect health outcomes? My objective is to break that down like we were talking about and say, were the benefits of that program evenly distributed in space and by race, by payer type, so Medicaid, commercial insurance, to learn more about maybe we need to cater that program to different populations. But either way, we're starting to actually be able to measure the impact of those programs and the outcomes in meaningful terms. Plus, we have a big resource for policy development as well. So, because you have an entire region full of pediatricians who are incentivized to be able to improve health outcomes and reduce disparities. But that helps answer. So anyway, we can apply it all over the place, but it'll be context specific. Even though that $1 and 146 saved was specific to Boston, it's a similar model that you can apply elsewhere, and there's other examples of it that have been successful too.
Very good, thank you. I don't see other questions in the chat or in the Q&A. Eva, you have a comment. Go ahead, please.
Yeah, I had a question for Kyle and Tyler. So in one of your charts, you showed that the service sector jobs were seeing the highest or higher growth, right, relative to other industries. Could you say that that's because this, the sectors tend to be more labor intensive, as opposed to, say, manufacturing or some of the others that you showed that are like finance, that is not as labor intensive, because finance was like at this lower end. So could that be the explanation for that result?
So, do you want to take that one, Tyler? Let me, I'll pull up real quick if I'm still able to share the chart that I think that's in
Yeah, please go ahead.
Yeah, I'm trying to find that chart as well.
I believe, is it? Oh. This one here, correct? Yeah. Do you want to take this, Tyler?
Sure. I mean, it very well could be that for sure. However, I think in terms of, I don't know if this is not exactly what you mean, but we have studies that show they cite the service sector that they do in fact have like more burnout and stuff, so more stress levels, so they are in fact more labor intensive and stuff. But this is finance is an interesting industry. So when we look at it in terms of value added, instead of just like the employment growth, this chart would look slightly different in the sense that finance's value added is extremely high for other reasons that potentially go into, whereas the value added in these other service industries on the right hand side of this graph is extremely low. So it's kind of like an interesting dichotomy there with that. But in terms of the intensity of the work, it very much could be, and this might just be capturing that in this last cycle of that general trend for the past 40, 50 years or whatever. But since we don't have the data going back that far, I guess your guesses would be as good as mine on that one. So
I think I just say those were also sectors where the sort of total employment didn't crash as hard as the like manufacturing and construction in the financial crisis, and so I think that's part of too what's explaining these the sort of divergence in the growth rates here, because this is all relative to the average for the economy as a whole. So as those other sectors, especially in the recession, are going significantly down, that'll increase sort of the distance that, or the rate at which these sectors are growing relative to the economy average. So whether it's more or less labor intensive, just because it's not declining as fast, right, or not declining relative to the others, will also show up as a higher growth rate there relative to the economy-wide average. And so you probably see a change there now. So obviously one of the things we're hoping to do with this in the next few months, when all the data is released for 2020 and the necessary adjustments are made, to see what this looks like in COVID, of course, right, for all of these charts. And I think these are the sectors that are going to have been most hit And so how that'll change the growth rates too, I mean, will be something to look at going forward. What we're, interested in seeing is whether sort of these, especially these cycles, if we basically just cut out the whole decline and are starting from these low points here, these points in 2009 and 10. And so if this is, again, we have to wait 10 years or so to get those types of recoveries.
Can I ask a clarification question about the graph that you just went to?
The one before this?
Yeah, the one where you did the loops, sort of, yeah, like,
Here?
the previous one.
Yeah.
Right. So if I'm looking at, say, 2004 or, any year for that matter, and it says that 40% or 50% are entering from unemployment, does that mean the other 50% are entering from being outside of the labor force?
Exactly. Yep. So this is just looking at entrance from what we would call from non-employment into employment. So it's not looking at any like job-to-job transitions from, say, involuntary part-time work to full-time schedules. This is just those coming from non-employment into employment. And so again, you see, I mean, clearly how important those flows from out of the labor force into employment are. The majority of those don't get picked up in any of the standard BLS measures. Most of these people that come from not in the labor force, they are not included in the marginally attached, which does get counted in U6. Most of them, if you go and look at the CPS microdata that we use for this, don't respond that they want a job in the month that they're not in the labor force, and so that's why they don't show up in the marginal attached or the discouraged subset of that group.
Yeah, and I would add, kind of going back to something that was asked earlier in terms of what to expect in the absence of some kind of strategic fiscal policy, perhaps like a Green New Deal, like we're talking about, is if one of the indicators that's used is the unemployment rate to try to gauge unused resources in terms of labor. What we're showing here, and that Kyle and Jordan and everybody's kind of been working on with the labor force transitions, is that not only is like the unemployment rate kind of misleading in terms of that it's more than misleading, since we find consistently more people enter into employment that are technically classified as not wanting a job. So another way to think about, to put this in context of like equity and stuff, we could think about in terms of, there's literature about the rising precariat, there's rising worker dissatisfaction on the job, high levels of insecurity. Well, I don't know the exact numbers off the top of my head, but recent polls for the past decades show increasing percentages of people concerned about the climate. So if a Green New Deal perhaps were implemented to address some of these and also account for a larger percentage of people that want employment that standard indicators don't suggest is there, then that could be, if implemented in a strategic way, that could address perhaps some of those aspects of the disequity problem and things like that. So those are some kind of areas that we want to look into further research in terms of this, of like what that might mean. But yeah, if that can help, just mention why some of that might be important, I guess.
I'd also say, so one of the things that I think is being captured here, we'd have to do a little bit more, but is differences across the sectors in terms of, especially in the downturn, using like temporary layoffs and then recalling workers, because those workers are classified as unemployed, but generally transition back into employment at much higher rates because you still have some sort of employment relation. Whereas, the sectors kind of in the bottom left here, I think that's much less common. And so you see more of this in and out of the labor force directly. But it's also, yeah, these ones at the bottom that we're growing more.
Thank you. I don't see additional questions, so I'm going to encourage people to post in the Q&A section. But in the meanwhile, I'm going to continue to abuse my position here and ask more questions. So the first question is, I guess for Natalie in particular, but everybody else is welcome to give their input, which is this thought that emerged from just listening to all these presentations, which is introducing a Medicare for all under the current system today. Medicare for all alone would be actually, substantially more affordable, cheaper, if it's introduced with the Green New Deal that addresses the socioeconomic disparities that Natalie was talking about. So there's a case to be made that a comprehensive Green New Deal program, which includes addressing housing and health and education and jobs and climate issues, is actually much more effective than doing the incrementalist, let's do healthcare first and then worry about unemployment and then worry about climate. Does that make sense?
Yeah. So I mean, either way, regardless of whether we were tomorrow to implement Medicaid for all, to be able to resolve the problems that we're talking about when it comes to health disparities, which again are tied to economic, racial, and spatial inequalities, things that are also tied to environmental inequality, will require this kind of this transition towards addressing the social determinants of health, either directly or indirectly, and ideally at least partially through the healthcare system and healthcare itself. So, because if you want to be able to actually move the mark on those problems that we're talking about, then you need to be thinking about how you actually solve those problems. And when we talk about applying like the transformational prospect of the Green New Deal, these programs, again, it's really important to take into consideration what that would actually look like at the local level. So what needs to be done in these communities that's also contributing to the problems that we see that are coming out in places like healthcare, where we're seeing really high utilization rates and poor health outcomes. So together with healthcare reform, even if we do transition to Medicaid for all, we need to be able to think about how we apply those resources to effectively eliminate these disparities. One example I think of a lot is the opioid crisis in rural America, which can in part be tied to employment. So there's more manual labor, more opportunities for injury, more opportunities for treatment with opioids, and then also more difficulty getting access to alternative healthcare resources, in part because, again, those health systems are under-resourced themselves, so then you have geographic issues as well, and just lack of access to basic services, being able to make appointments, being able to take advantage of other physical or emotional services, psychological services that could help you deal with those kinds of injuries. So one of the things I mentioned in my little policy note is, okay, well, and I'm sure there's already a basis for this in some places. You can think of like a rural transit service that you could build as a part of your healthcare reform in those areas. So making it possible to employ people who need a different type of labor that suits them, to be able to transport people back and forth, to being able to get access to fresh groceries. It can also serve as a tool for being able to deliver fresh groceries to people, and then also making sure people can get access to the healthcare they need, so that ideally we stop depending on these downstream treatments and start treating the upstream problems. So it's not just the injury, it's also the unemployment that's the issue, and we can start to make that a part of a comprehensive healthcare response. But either way, we need to be more strategic with how we use resources to address social determinants. So savings or otherwise, the outcomes need to be the priority. And there is at least the basis for that conversation with healthcare reform as it has started. And I meant to mention that earlier. While I do emphasize that there are cost savings to this strategic approach, that is also to applying Green New Deal programs or modifying how we think about healthcare as a means for addressing social determinants, we can still prioritize the outcomes, and we should, because like Yeva was talking about, the costs of this program are not really the priority. I think the outcomes really need to be, especially when it comes to sustainability, either in terms of social health or environmental sustainability.
Thank you, Natalie. And I just posted a link here to a White House report putting the cost of the opioid crisis over the last 4 years at $2.5 trillion. So that's the cost of doing nothing right there. I see a question from Mike in the Q&A section. And I think it's for Yev. I don't know, Yev, if you got a chance to read it, but I'm going to try to read it for the audience in case they can't see it. And I think it got cut off, so I'm going to try to put it together. So Mike says, clearly the problem with implementing the Green New Deal is political, paralleling the mobilization of resources to fight World War II. I'm going to skip the parentheses there if I can. Could we think of the mobilization to fight both COVID-19 and climate change as a war, even more serious than World War II? Because if the human race loses the climate war, we might seriously be looking at extinction. And then he says, to continue, the political argument should be that the US, but also the world, are in the fight for survival, requiring as much national mobilization and the use of federal power to make things happen. Just as in World War II, the government ordered car plants to produce planes and tanks, decided who would be drafted and who wouldn't, and introduced rationing. Mike continues, to fight COVID, the federal government needs to mobilize people to fill the gaps in the delivery of vaccine and so on.
Yeah, I would totally agree that we need to use the analogy of a war as much as, might be unpleasant to some extent. But yes, that's what we argue in our working paper, which is what the journal article is based on, that we need to treat the climate change as the moral equivalent of war. In that I would agree that the stakes are higher this time because it's the human civilization, the survival of civilization is at stake. And especially if you have kids, I think you worry so much. I don't know, it completely changes your perspective about the future. Not saying that people without kids don't think about climate. I'm just saying it makes the issue more acute for you. Yes, so I would say we need to treat it as a moral equivalent of war, and we need to approach it as such, and we need to bring in planning. That was part of my argument, that we can't just, the Obama stimulus had some kind of greening component into it, right? I mean, it was measly, it was meager, it was very small, but the approach itself was the problem, that you just give subsidies to companies and then you just hope that they would come up with technologies that you need and so on. That's not what we did during World War II, right? The government ordered companies to produce things. It told car companies that you can't produce cars, or at least not as many as you were producing, because we need the steel for the war effort, right? And that instead you need to be producing the stuff that we need for the war, right? And we could have done that with the COVID, of course, as well, that we could have ordered companies to do it, or we could, in the United States, there isn't a lot of public production, but in Europe, where you have more public production, I think you could do it more through your public companies rather than just ordering private companies to do it. I think you could have some more control over that. But yeah, I would completely agree that's what we need to do. And I would say that even when the original New Deal was being implemented, they were invoking World War I and planning for World War I, and they brought in a lot of people who had been working in administering, the government in planning World War I, and they brought these people into the New Deal administration to use their expertise. Yeah.
Great, thank you. So I see that we have a few minutes left because we have a hard stop at 12. So if I may, I don't see any other questions in the chat. I wanted to bring up the questions related to the job guarantee, which was mentioned a few times today. In the policy space, there's a lot of discussion of the job guarantee in the context of the Green New Deal as a nice add-on to the program, as opposed to a core feature. Which I think was highlighted by the first paper here, that there's a core group that a lot of people in the job guarantee literature have discussed, who are first to be fired during a recession and last to be hired, the structurally disadvantaged individuals in the labor market. A standard stimulus that pushes the economy, quote unquote, to full employment like pre-COVID still leaves millions of people unemployed. So there's that component of the job guarantee that addresses the structural unemployment issue. The other feature is for decarbonizing the economy. And as Yeva mentioned, there's going to be quite a bit of displacement of workers, not only in the fossil fuel industry, but also in the healthcare industry with a more efficient Medicare for all system. So as a just transition, as in guaranteeing employment with decent wages and benefits, can't be left to the market to guarantee a transition for workers. So I wanted to hear a couple of comments on this before we leave. We have about 11 minutes to go. Actually, yeah, just about 10 minutes. Not all at once.
Yeah, I would just add that we are going to need employment resources that are similar to what exists in healthcare now. Even in the full system that is currently doing a lot of churning and unnecessary work that is a part of the expense and difficulty of gaining access to healthcare. We can think of, again, if we need to administer context-specific solutions, whether you're thinking about it in terms of environmental programs, or you're thinking about it in terms of more community-based or regional level employment, housing and wellness, which again are a part of health, should be a part of healthcare, and our response to health inequities, then that requires a lot of management anyway. So there is going to be at least some ways that we need to invest in those industries. And furthermore, another thing I'd just like to bring up that might be just a little bit off topic and something I think about a lot, because there are still lots of people that will say, well, people just don't want to work, which, in and of itself is not true. But then also, if that is true for an entire community, that's again evidence of exclusion from the labor market, deep inequalities over generations. And that's a problem. It's a health problem, an economic problem. And so there's a lot of room to expand things like social services. So beyond providing, basic access to resources and being able to participate in programs to be able to heal these communities, do whatever they need to do in context based on their needs, that requires resources and will require an investment. And that's employment. You need people to be able to do those jobs in particular. That can't be outsourced to technology. But
yeah, I think on our end, that's where a job guarantee comes in, especially. So one of the dimensions we showed in our cycles and that analysis of employment over the last 15 years or so was a distinction between full-time and part-time. And we're not obviously advocating that everyone should be working full-time. We want there to be flexibility for people to accommodate other parts of their lives, right? But there's a lot of evidence, and part of the reason why we didn't break up that part-time into what's traditionally defined as voluntary and involuntary part-time, that a lot of surveys, the Fed was doing surveys before COVID, like half the people that were working part-time said it was because they didn't have other opportunities, right? Because there weren't opportunities for full-time work. And that's one of the things that the job guarantee, I think is designed to do, to put that option there, exactly like Natalie said. Another thing that parallels I think it was Boston project that Natalie talked about, the cost savings that Fadl brought up earlier, right, is that I think you can also think of providing employment as reducing a lot of costs that we have now associated with essentially the status quo, associated with allowing for involuntary unemployment to persist, and all of the health and community related costs that go with that.
right.
So again, when you talk about sort of these policies coming together, thinking about cost reductions in various places, all that I think relates quite.
So that's that's partly the argument I was trying to make, and that's an argument we make in our paper, in that you do need a comprehensive Green New Deal, because you are trying to tackle issues that are interrelated. And from the macroeconomic perspective, in terms of inflationary and deflationary forces, that's good to do it comprehensively. But it's also good because, as you mentioned, people will be losing their jobs in the healthcare sector, and they will be losing their jobs in the fossil fuel industries. So with the job guarantee, you're providing them a transition to other jobs and careers. So that's, so it's, the comprehensive nature is good both for the more macroeconomic numbers reasons, but it's also important for the jobs reasons. Yeah, absolutely.
Thank you. And I see one more question from Ron, but before that, if I could ask the panelists to post their email addresses in the chat box, because people are asking if the papers will be available. This way people can communicate with you directly to get a draft or the published paper eventually. And the recording will be posted, I believe, on the ASSA website or somewhere. I think all the sessions will be recorded, so people will find them. The final question from, and the tech person is telling me, yes, the recording will be available. The final question from Ron in the 5 minutes that we have, it's a long question, so I'll again invite people to Ron's session on Tuesday, and there's a link to it in the chat on climate change. The question, I believe, is essentially about rapid triage in terms of prioritizing what a global Green New Deal framework would tackle first, starting according to Ron here with ice caps and closing the carbon cycle as the absolute necessary kind of beginning points of tackling climate change, and then building the rest of the framework from there. I'm probably butchering the question, but it's right there in the chat box and in the Q&A section. I don't know if anybody is able to address it at least briefly in the next couple of minutes that we have. If not, I would invite everybody to Ron's session for a full discussion.
So I would say that this is the kind of question that, scientists need to decide, right? So, and that was my point. The broader point in our paper is that this is the financial stuff, right, is not important. What's important is the technological feasibility. And this is a question for scientists, right? So the best that economists can do, they can say, we can afford it financially. We need to worry about where we find the resources. Tell us what resources we need to find, right? Because I don't know what resources we need to find for greening the economy. That's what scientists can tell us, right? The carbon removal technology that is being mentioned, if it's the same as carbon capture, then my understanding is that we don't yet have the technology to do so, at least not on a large scale for it to be effective, at least not in the short period of time that we need, right, to do it. But again, that would be a question for scientists. My layman's understanding is that we don't yet have the technology to do it at scale.
Thank you. And I will just add one quick comment to this, which is, going back to World War II, when FDR was asking, about the possibility of winning this war, he asked about, how many fighter airplanes do we need? He didn't ask about, how much money do we need to win this war? And the challenge at the time was to produce enough to actually win the war, as opposed to, how much money is needed to win the war. So with that, I'd like to thank all the participants and the panelists, the presenters for wonderful presentations and discussion. And I'd like to thank you for joining us today. And again, I'll encourage people to visit other URPE sessions and help us keep this discussion going, despite the fact that we're not together in Chicago today. So with that, I'd like to close the session before we get cut off abruptly. So thank you again for joining us.
Thanks, Fadil. Nice
Thanks, Fadil, for your great moderation.
Thanks.
Master.